GPS technology. It seems to be everywhere now, in our cars, in our cell phones. It's even found in some of our watches. As Rod Starnes shows us in our cover story, this technology is also being applied in surgery to help guide doctors in diagnosing cancer.
According to the Centers for Disease Control and Prevention, lung cancer is the leading cause of cancer deaths in the U.S., causing more deaths than breast, prostate, and colon cancer combined. Each year, more than 200,000 new cases are diagnosed.
That's a grandbaby. That's a great-grandbaby.
Ernestine Lee is one of those 200,000 patients. As a security guard, a school crossing guard, mother to 6 children, and grandmother to 28, she knows all about keeping an eye out for problems. A little more than a year ago, that's exactly what she had to do. When her right lung collapsed, she went to the hospital and the doctor discovered something potentially disturbing.
They saw something, he said, bro, just a little white spot up under my skin. They didn't know what it was. He said it's very small. And right now I don't know what it is because it's too small.
For many patients, the first step toward cancer diagnosis is a suspicious spot on an X-ray or CAT scan like Ernestine had. That's a situation which in the past left doctors like pulmonologist Eric Folk from Baptist Memorial Hospital DeSoto with 2 less than desirable options to determine if the spot is indeed cancer.
5 years ago, 10 years ago, your doctors would scratch their heads and would say, we have 2 options, to operate on you and crack your chest open and get part of your lung out, or we can wait.
An invasive procedure can put an older patient or one with poor lung function at increased risk, so many doctors could only offer a wait-and-see approach. Wait and see if the suspicious spot grows, indicating the spot is likely cancer.
The problem with lung cancer is our worst enemy is time. We need to catch these things early, we need to treat them early, and if we're going to attack them as soon as we can.
Getting into the deepest parts of a lung to find a tiny spot without harming the patient in the process can be a difficult task. And that's where technology lends a hand. Using the same principles found in your car's GPS, doctors can now map out an early and accurate diagnosis.
It takes your CAT scan, marks the spot, introduces it in a software, and allows me to mark several reference points in the patient. And it creates an electromagnetic field around the patient. And when I'm inside the patient, just like a video game, it tells me you're closer to your target, until I hit it.
The procedure is non-invasive and takes about an hour or so. The doctor simply inserts a catheter through the nose or throat and steers through the multiple branches of the bronchial tree to hit the spot and take a biopsy. One step in mapping out a diagnosis.
This is a diagnostic procedure. I'm not treating the cancer. The patient goes home at 11 and 2 or 3 days later gets a phone call from me, comes back to my office, and I say, you know, good news. This was nothing. We don't need to do anything about it. Or it gets bad news from me, or relative bad news. Say, this is cancer. It's at a stage we can treat it with surgery.
Ernestine remembers all too well the call she received from Dr. Folk.
He told me that he had got the result back, and he had bad news and good news. He gonna give me my bad news first. He said, we did find a little cancer in your lung, right lung. But the good news is not at a stage 1 yet, and it hadn't spread any. So we're gonna go in and get it. We're gonna get the whole lung.
Would she have had this surgery without the certainty this is cancer? No. Would I have advised her to have surgery without having the diagnosis? No. We're trying to minimize uncertainty in medicine.
One thing is certain, this latest miracle of modern medicine is giving patients much needed information in order to make some difficult decisions. For Ernestine, her decision is paying off big time.
It made a believer out of me. I know what they can do. I know what the doctor can do. I know what those machines can help do, because I know they helped find what was going on inside of me.
She's cured. She not only did she stop smoking many years ago, but she has one lung and she does all her activities of daily living and she's perfect.
I'm doing more now, and I did like in 20-some years. I get on the treadmill, I get on the 2 big bikes, and now they got me lifting the weights. But look at me now.
For Smart Medicine, I'm Rod Starnes.